16th of March, 2022, Wednesday. And as we call the meeting to order, we will be addressing the Public Health Committee JF meeting today. I know many of the legislators who are driving up 84, there is a major traffic related problem. So I know some of the people may be a little late. I can tell you our co-chair, Jonathan Steinberg, is also running a little late. So he sent me the message to go ahead and get started. I know we have a session today for the House as well as for the Senate. So in view of that, we're going to go ahead and get started. We will keep the votes open till 10:30, and that's about the time when the session in the House will be called. As we start this, some of the important messages include that as we have some of the legislators who are physically in the hearing room and some are joining via Zoom. While if you are in the room, just turn off your camera on your computer, mute yourself and turn off the volume on your laptop as well. This will prevent any audio feedback or disruption during the committee. And when you want to speak, you do not need to unmute yourself. Because the hearing room mic system will pick up your comments. And also when you are voting by the roll call, if you are on Zoom, you just do the way we have been doing for the past 2 years. But if you are in the hearing room, you actually just need to stand up, state your name, and speak in the mic that is in the hearing room. So with that, I know Senator Steinberg is not here at this time, but I would love Senator Summers to have some opening remarks.
Yes, good morning, everyone. We have a pretty non-controversial agenda today. We have worked on this in a bipartisan measure, so I'm hoping that we can get started and get these bills out of committee so that we can all get on to our session days. So thank you for being here, and I think we're ready to get going.
Perfect. Thank you so much. And I know Dr. Pettit is driving, so you don't have to make any remark, but if you want to, you're welcome to. You're fine. Okay. Thank you so much. And with that, we'll move on to the next item, which is bills for review. Mr. Chair, please go ahead and make your opening remarks, start your opening remarks. Or we can, there you are. We cannot hear you.
Hello?
Over again.
Yeah, now we can.
Good morning. Jonathan Steinberg, State Representative, 136th District, co-chair of the Public Health Committee. The Democrats had a caucus that just concluded a few minutes ago. That's why a number of us are late, just entering either the room literally or virtually. But good to see you, Senator, and good to be here. I hope you're correct in that the bills we have are non-controversial, though the first one may actually turn out to be a little bit more so. Would you like to take the lead, or would you like me to?
For now, what I'll do is I'll start, and then we can move, and then you can take the lead, and I'll start to drive to the Capitol, and then we'll multitask that way.
Sounds great. Go ahead.
Okay, so the first item on the agenda is SB 254. I would entertain a motion to JFS. Motion for SB 254, an act requiring long-term care facility residents to undergo a criminal history and sexual offender registry search. Is there a motion?
So moved. Second.
And do you know who moved?
I moved it, and
Okay.
Senator Gilchrist, Representative Gilchrist seconded.
Second was Representative Gilchrist. And is there discussion? Before the discussion, I can give you a quick little update. I'm sure during the public hearing, you all have heard a number of concerns that were raised, and we heard them loud and clear, and we want to make sure that we incorporated those changes in our bill. This bill is different than what was in the public hearing. So the JFS language that is there is actually less restrictive. It's only focused on the sexual offender registry search for patients who are going to be admitted to nursing care facilities. And it is not resulting in restricting people from being admitted to the facilities, but it's actually assessing the safety of the workforce, the people who are going to be the nursing staff and other staff who are in the facilities. They should be aware, and there should be a plan of action for making sure that there's a prevention in place. This is not doing any other background searches. It is not doing any other extensive searches that we're talking about. It's just making sure that the basic assessment for being on the sexual offender list is being looked at, and that is just for workforce prevention. So it's completely different in many ways from the previous bill. So with that, I would entertain any discussion or comments. Yes, I will start with Representative Steinberg, followed by Senator Kushner.
Thank you, Mr. Chair. Just to be clear, you have in the JFS language, which most of us have not had a chance to see yet, greatly simplified this to be much more directed and not to include several sections that were problematic. Could you just be a little bit more specific as to which sections are now no longer in the bill?
Sure. Actually, I don't have the older version in front of me, Representative Steinberg, but the bottom line is, in the previous version, we were actually doing extensive background searches. And that was part of the challenge, that if we started to background searches, the time it's going to take for approval of the patients would be much more complex. That was part of the process. We did not want that to have another few days for a person to be sitting in a hospital getting the background check or another facility. And that's entirely removed. We are just looking at the section which is going to have their assessment if they were on sexual offender registry, a federal registry, and that should allow a relatively shorter time to assess that, and the Department of Public Health will help with that process.
Thank you for that. I do know some of our colleagues have expressed some concerns. I'll let them make their own statements. Thank you, Mr. Chair.
Thank you. I have Senator Kushner. You're unmuted. Please unmute. Yeah.
Thank you. I recognize the importance of keeping our staff safe and other residents safe, but I am concerned about the bill the way it was drafted. I have not had a chance to review the S language, and I appreciate how important this is, but I also recognize that there are concerns about and we heard testimony from people who are concerned about the registry itself and risk assessment that needs to be done in conjunction with the registry. And I don't know that we've taken that into account. So I would be concerned about voting on this without first really looking at the S language and having an opportunity to fully debate and discuss the bill. So I know I would appreciate it if we could hold this until a future meeting.
Okay, and thank you for your comments. I can share with you that there are some of the concerns that were raised have been addressed, and we can also further manage this, but clearly there is a problem when some of our nursing staff are directly impacted, and now we have had one major incident in our state. So we would not be able to fix the registry in this session. So that may be a separate bill, and if the registry is the issue, and especially the federal registry, that may be beyond the scope of this committee or this legislature. So I just want to make sure that we keep that in perspective as we anticipate changes. We will not be able to fix the registry going forward. But thank you for your comments.
Can I make a further comment? Because I don't want it to be misunderstood. I really my work as chair of the labor committee, I've been involved in occupational safety and health for, decades and decades. This is something that I feel is incredibly important. So it's not out of a lack of concern about the staff or how we protect the staff or other residents, but it really is about looking at it in a holistic way. I think there are many factors that contribute to safety for the staff, including, as we heard, many patients with dementia often pose a risk to staff. And, I think I would like to make sure that we're dealing with this in a holistic way, in a humane way that really addresses the needs of everyone. And so, for that reason, I'm really concerned about, it's a really important issue, and I want to make sure we get it right. So thank you for allowing me to make these comments.
Thank you. Representative D'Amico.
Thank you, Mr. Chair. I would like to echo some of the comments that were made previously. Certainly, the original version of this bill, which had 10 entities testified, and they were all unanimously in opposition to this bill. So clearly there were problems with the original version. I appreciate the fact that it is a serious problem, and I appreciate the fact that you are doing yeoman's work in trying to fix this problem. However, in view of the fact that several of us have not yet even seen the substitute language, which I'm sure is better than the original language, but in view of the fact we haven't been able to study it, in view of the fact that this is not our last meeting, so we're not up against a deadline, I would like to respectfully suggest that we hold this bill until all of our colleagues have a chance to study the substitute language and make sure, as Senator Kushner just mentioned, make sure that we get it right. So that would be my contribution to the discussion. Thank you.
Thank you. Representative Terciak.
There we go. Thank you very much. I can't tell you, Senator, how much I am opposed to this bill. This bill will not pass. This bill should not pass. This bill ignores our history in the state in just the past few years. We have a facility called 80 West in Rocky Hill. It exists to take people who have been on the sex offender registry and in prison, who have been assaulted and were at CBH, who were trapped because of their police records and nobody willing to take them for as much as over a year in emergency rooms in the state. The classic example is the guy with paraplegia, stuck in a wheelchair, unable to move himself, and could not get admitted to a convalescent home in Connecticut because years and years before, back when he could move, he had assaulted someone. I don't remember whether it was an adult or a child, but I do remember that my favorite excuse for why he couldn't be admitted. What if somebody who didn't know his history put a baby on his lap? How would he, and then he could assault the person? Well, actually, the essence of his being quadriplegic was no, he could not assault that person, separate from the stupidity of do people put babies in the laps of strangers? We have this whole convalescent home just because we understand the reality is there is not a convalescent home that will take the liability of having one of these patients. To pretend that just having them know is all we're going to have happen is wrong. It's wrong. We know these people are going to have to stay wherever the hell they are, whether it's an emergency room, whether it's a police station, whether it's prison, whether it's CBH or some other institution. They're going to have to stay there until there's an opening at 80 West because we're just perpetuating the problem. And for Senator Kushner, who's worried about the employees, so am I. This nurse cares about it desperately too. When you talk about the danger to employees, though, in this situation, I'm reminded about the early days of HIV and AIDS, when it was believed that we could not be safe unless everybody who had HIV or AIDS had whatever it was, a red sticker on their chart, the staff notified, as if that was the only way to get hurt. If we really want to cut down on assaults, all we have to do is mandate that employees in convalescent homes be given for free a danger button to wear, just like my mother-in-law wears around her neck. Push the button, the world knows you're in trouble. That would stop people from being horribly assaulted, horribly hurt in assaults. We could mandate enough staff so that wherever you are, where patients are, if you scream, "Oh no, I need help," somebody should be able to listen to you. Those are things that will actually make a difference and will not trap people forever outside of the care that they should be receiving. To do this is just saying we aren't willing to spend on what really works. We know what works. That's why in many settings we have staff that do in fact wear a safety buzzer that will get them attention, like get them help and notify there's an emergency like that. That it might possibly work, because we've got no stats here that, by the way, you're more likely to be assaulted in a convalescent home, badly assaulted in a convalescent home, or assaulted at all by somebody on a sex offender registry than you are likely to be assaulted and hurt by somebody who is not. Odds are you're more likely to be assaulted and hurt by somebody who's not, because of how many people in convalescent homes have dementia and other cognitive problems that rule their behavior. And because that's a constantly changing line, where people who were good last week are slipping over the line into you shouldn't trust them this week. We know that's what's going on. To do this is to deny the employees the one thing that works. If we want to keep the employees safe, all we have to do is stay up late at night and answer one of those stupid TV commercials that says, "Where our button," and people will know instantly that you're in trouble. It can tell that you've been knocked down and you're unable to yell. You can push it and people will know you're in trouble, even though you're not yelling. That would work. This is just punishing people, and people should not be allowed to say it will not punish people, because our history is too new. It will punish people. Thank you. I'm all set.
Thank you so much for your comment. Thank you, Representative Tersiak, for your comments. I think the JFS language that is in this bill would not apply to the person that you were referring to, the example you were referring to. So I would just respectfully suggest that this language that is enacted in Ohio as well as Massachusetts has not restricted people from being admitted, but it's actually just save the workforce. So it's not restricting, it is just assessing to make sure that there's a plan. There's just like there's a care plan, there's also a safety plan. But the language is completely different from what you had seen before. So I think that's why.
No. It's not the language. It's the history of any police record, and making it just the more serious ones than not.
You're not asking for police records.
It doesn't matter if you're telling people or not. Whatever history we are giving, whatever crime it is that is required, those people, although we say they have permission, and although we claim that in Ohio and Massachusetts, nobody minds, they're welcomed with open arms, because at least we know their history. As long as their history is part of what goes on, people are not going to be admitted to the convalescent homes. And we know that's true. We pay extra money every day for a convalescent home that is just for people who have histories, and we pay extra for it because of those histories. And by the way, it's a remarkably safe place, but we know from experience, you can't pretend that anybody with one of these histories used to get in convalescent homes in Connecticut. They don't. They never did. Period. End of story. Or we would not be spending the money on 80 West. Until you can convince me that there are people in 80 West who would have been admitted anywhere else, then this is wrong. And we know we don't need it, because we could put emergency buttons on everybody, but we'd just rather have people rot in emergency rooms or wherever the heck, or whatever institution they're in, rather than actually keep the staff safe from real dangers by giving them a not very expensive warning button, period. A not very expensive warning button. And that would work That would protect them from the patient with no history. And by the way, it's not even patients with dementia. Assaults on healthcare workers are phenomenally high. They are only growing in spite of laws being responding to them saying, oh no, let's lock people up for 10 years. We know that's the case. We know we have absolutely no reason, judging by what we have as a history in Connecticut within the last few years, we have absolutely no reason to believe that this bill will work the way it's being described. We have every reason, judging by Connecticut's history in just the last few years, to believe this will not work. So also, if our goal is to prevent folks from being assaulted, we know this is insufficient. Until before this happened, workers were being assaulted and hurt in convalescent homes and other settings. We could do something to make them safe when they're assaulted, instead of pretending that it matters who is assaulting them in terms of their safety. And we can do that. It's not even horribly expensive. If we don't do it, we are going to yell back and forth about this wouldn't be expensive. And as opposed to this feel-good bill that is not going to keep people safe and that it's not going to help the patients, instead of that, which will be a failure on both of the intended consequences, we could have something that would work. Emergency buttons on staff carried on their persons. And instead of spending a couple bucks a month, we're talking about something that will not increase anybody's safety, except possibly on a margin. And even there, if it worked as it was supposed to, we pretend that people would still be admitted to these homes. We know that's not true. If you want to say they'll be admitted to these homes, say that after the police check and the staff are warned, they have to be accepted. Nobody will put up with that, because the reality is they're not going to take them.
Thank you so much. Thank you so much for your comments. Senator Summers, please go ahead. And just
yes, thank you. I just wanted to say that
yeah.
I disagree with some of the comments that have just been made about the intent of this bill. However, we have now spent almost 25 minutes on number one. I'm suggesting that we do hold it so people have a chance to read the JFS language, digest the intent, so we can move on to possibly get the rest of our agenda out today, because I know we are starting session shortly. And the intent of this bill is behind the fact that somebody from out of state was moved into a facility here and a employee was assaulted. All of us have the employees and the patient's best interest in mind. No one here in the Public Health Committee is believing that people that have made mistakes in the past should sit in an emergency room for an extended period of time. That is not the intent. So I would suggest that we hold this so we can get through the rest of our agenda. People have a chance to read the JFS language, and we can have a robust discussion at a later meeting when we have more time.
Thank you so much. I think I'm getting the gist of it. I think we should hold this. Now, can I ask our LCO, should we, because the motion has been made and seconded, should we move on to the next item or should we take the motion off the table?
If you're going to hold the bill, you should withdraw the motion and the second.
All right. So may I ask?
I have to raise. My hand is raised. Mr. Chair,
Yes.
I'm struggling with my mask. Mr. Chair, I respectfully withdraw my motion.
And Mr. Chair, I respectfully withdraw my second.
Okay, perfect. And then we move on to the next item. Thank you so much, everybody, for a robust conversation for this. And please, please, please read the JFS language. Thank you. Moving on to the next item, SB 330, an act prohibiting discrimination against persons with a disability who are candidates to receive an anatomical gift. We'll entertain a motion for JFS for SB 330 at this time. Is there a motion?
So moved.
Is there a second? Thank you.
Second.
Second is Senator Summers. Any discussion?
Just that it's nice to see Senator Summers and I come together on this good bill, even though we disagreed on the last one. This is the way it's supposed to work. Thank you. That's my only discussion.
Thank you so much for your comments, Representative D'Amico.
Yes, thank you, Mr. Chair. I don't want to belabor this. I'm just wondering if you could make a brief comment about what the substitute language does in this bill?
Absolutely. Representative Steinberg, do you want to take on that part, or do you want me to go over it?
Sure, I'd be glad to. Bear with me. Okay, this bill makes changes to a variety of DDS statutes, requiring the commissioner to develop a strategic plan to reduce the wait time for DDS services. This is something we've talked about in recent years, and submit that plan to the Public Health Committee by January of 2023. The OPM secretary to consult with all relevant stakeholders before implementing a plan to close any DDS operated facility, requiring the commissioner to notify. What's that? Am I in the wrong bill? Sorry, never mind. Okay, now this bill, we want to talk about this bill. This bill generally prohibits someone from being deemed ineligible to receive an anatomical gift or an organ from a living donor for transplantation solely because of the person's physical, mental, or intellectual disability, and would provide an exemption if a physician determines after evaluating the person that the person's disability medically contraindicates the acceptance of such anatomical gift or organ. And if a person has the necessary support to assist in complying with post-transplant medical requirements, the person's inability to comply with these requirements without assistance cannot be determined medically significant so as to make the person ineligible. That's pretty much the gist of it. This is something that would facilitate even people with disabilities from making anatomical gifts. I believe that answers your question, Mr. Chair.
Yes, thank you, Representative D'Amico.
Well, actually, it kind of answers my question. I was just curious to know what the substitute language changes from the original bill, only because I noticed that it is a JFS rather than a JF to the floor. But if there's no substantive change, then I don't want to belabor things.
There was a small error, Mr. Representative D'Amico, that was fixed because of the proponents wanted that to be cleaned up and cleared. That's the minimal change.
Fair
Thank
enough.
you so much.
I appreciate that. Thank you.
If I would entertain a motion to create a consent calendar. Is
So
there a
moved.
motion?
Second.
Is there a second? Okay, and any objections? Seeing no objections, we will have a consent calendar. And that brings me to the next item. And I think for the next item, may I ask?
Mr. Chair, would you
yes,
be able to please add that bill to the consent calendar?
Yes, thank you so much, Senator Summers. Is there any objection to add item number 2, SB 330 JFS to the consent calendar? Seeing no objection, that will be moved to the consent calendar. And going forward, I would ask our esteemed co-chair to take on the meeting going forward. I will drive over to the Capitol meanwhile.
Okay, have a good trip.
Thank you.
All right, bear with me while next up is Senate Bill 331, an act concerning the provision of developmental services and mental and behavioral health services. This is a JF to the floor. Do I have a motion?
So moved.
Moved by Representative Gilchrist, seconded by Representative Pettit. This is a bill which sounds familiar to some of you because I just talked about it a moment ago, that seeks to do a number of things to address some longstanding concerns with DDS. These are issues that this committee has discussed in past years. I would describe it as a work in process that we've been asked to get out of committee to see if some of the concerns with some of the specifics can be worked on further. Are there any questions or comments? Is there any objection to adding it to the consent calendar?
Mr. Chair?
Yes.
Oh, I'm sorry, I missed that. I'm trying to do two things at once. Senator, Representative D'Amico, I thought your hand was up.
Thank you, Mr. Chair. I appreciate the fact that this is a work in progress. I just wanted to point out a couple of things as you're working on the bill. The one thing that jumps out at me is section 6, which is lines 80 through 87, which requires or would require that medical personnel, doctors, nurses, and so forth, give a mental health examination to every patient during their annual physical examination. And the two big questions that raises in my mind, number one, are all of these medical personnel qualified to give a mental health examination? And secondly, suppose the patient does not feel comfortable being subjected to a mental health examination at their annual physical exam. So to me, section 6 is something, if this is truly a work in progress, this is something I would recommend that you work on. Thank you, sir.
Thank you. That's exactly our intent, is to work on the work in process, and we take your points on section 6. Representative Tersiak, you had your hand up. Have you taken it down?
Now that you've given me the chance to speak, I'll decide why not again. I was just going to mention my opposition to this bill, and I'd rather not see it on the consent calendar. Thank you, Mr. Chair.
So we seem to have an indication that we should take a roll call vote. Are there any other comments or questions? If not, Madam Administrator, whenever you're ready.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes. Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes. Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
I did not see you on screen, Representative Gilchrist. I'm not sure what's happening.
Sorry, Representative Gilchrist votes yes.
Thank you. Senator Wong, Senator Summers,
Senator Summers votes yes.
Representative Pettit,
Madam Chair,
Representative Pettit,
Representative Pettit votes yes. Madam Chair, with green 1 day early. Thank you, Madam Chair.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Betts,
Representative Betts votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook, Representative Dauphiné, Representative D'Amico,
Representative D'Amico passes.
Representative Elliott, Representative Foster, Representative Django, Representative Green,
Representative Green votes yes.
Senator Haskell, Representative Cavros DeGraw,
Representative Cavros DeGraw votes yes.
Representative Kennedy,
Representative Kennedy votes yes.
Representative Clarice Detrier,
Representative Clarice Detrier votes yes.
Representative Lenahan, Representative McCarthy,
Hardy votes yes.
Senator Moore, Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon. Representative Terziak.
Representative Terziak votes no.
Representative Young. Representative Zupkis.
Representative Zupkis votes yes.
Thank you, Mr. Chair.
Madam Administrator, Representative Jenga votes yes.
Thank you, sir.
Madam
you.
Administrator, Senator Haskell votes yes as well.
Thank you.
Thank you, Madam Administrator. As the public can see, many of us are in transit. We had an early start this morning. Both chambers are in session today. And with that in mind, we will be holding votes open until 10:30 this morning. Moving along to item 4 on the agenda, an act concerning suicide prevention. This is a JFS to the floor. Do I have a motion? Moved by Representative Pettit, second by
Representative Gilchrist.
Representative Gilchrist. This is a bill that we've been working on for some time. I would also describe this still as work in process. We had a lot of good testimony coming out of the most recent hearing. And I strongly recommend that we move this bill forward so we can complete the work and the conversations we're having with the interested parties. We really want to support the good efforts that are already going on in the suicide prevention sphere. Any questions or comments? Any objection to adding it to the consent calendar? Seeing none, we will add it to the consent calendar. Moving to item 5 on the agenda. Senate Bill 372, an act concerning the Department of Developmental Services recommendations regarding green initiatives in residential facilities licensed by the department. This is a JF to the floor. Do I have a motion?
So moved.
Moved by Representative Gilchrist. Do I have a second? Second by Representative Pettit. This bill requires DDS to encourage residential facility operators to adopt standards and practices that promote energy efficiency, incorporate environmentally friendly construction materials and techniques. It also allows residential facilities to participate in DEEP's energy assessment programs. Those who do so must provide a copy of any energy assessment report it receives to DDS. And lastly, the bill requires the commissioner by July of 2023 to report to this committee on the findings of the energy assessments performed on residential facilities and recommendations for further energy efficiency improvements. A good green bill. A lot of our facilities are on the older side. It could really benefit from such an assessment. Do I see any questions or comments? Seeing none, is there any objection to adding it to the consent calendar? Seeing none, it will be added to the consent calendar. Moving to item 6 on the agenda, Senate Bill 373. Again, a DDS bill, DDS's recommendations regarding family support services and the Family Support Council. This is a JF to the floor. Do I have a motion?
So moved.
Moved by Representative Gilchrist. Seconded by? Seconded by Representative Kennedy. Thank you, Representative Kennedy. This bill repeals current law, which makes DDS responsible to coordinate family support services for children with disabilities. In practice, most of these services are provided by other agencies, and secondly, establishes DDS's Family Support Council. In practice, this council has not met in several years, and hopefully this will give it the oomph it needs to get back together and look at the important issue of family support services. And also this makes some conforming changes. Pretty straightforward. Comments, questions? I see Representative Carpino has raised her hand in 2 ways.
Thank you, Mr. Chairman. I wasn't quite sure the right way to do it sitting across the room from you. Can you just explain who will be responsible for coordinating, because it is done by different agencies now, just so that the families and the parents understand what in fact will happen should this bill pass?
Thank you for the question. I'm not an expert in exactly who does what to whom, so to speak. But DDS has assured us that that the existing shared responsibility is such to take care of all the family services This is really almost more technical in nature, acknowledging that they have not played a role in this regard, and then it's been other agencies. Depending upon who you're talking to, it could be DCF, it could be, I suppose, even DPH, depending upon the specialty area. I can't give you greater specifics, but I'm glad to try to get them to you, presuming we pass this bill out of committee initially.
Thank you, and I appreciate the answer. I'm going to vote no today to flag it, only because I want to make sure that the families are going to understand that there will still be coordination. So I think we need to have a clear plan for those folks that it will impact, and I suspect the agencies have one. I just want to understand what it is before I say yes to this. Thank you, sir.
Thank you for your comments and for your concerns that we all share with making sure family support services will be maintained, if not improved, from its current status. Other questions or comments? Based on Representative Carpito's comments, we will do a roll call vote. Whenever you're ready, Madam Administrator.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar, Senator Kushner, Representative Gilchrist,
I'm sorry, Senator Kushner votes yes.
thank you. Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong, Senator Summers, Representative Pettit,
Representative Pettit votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger-Givallo,
Representative Berger-Givallo votes yes.
Representative Betts,
Representative Betts votes no.
Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Okay, Chris.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott, Representative Foster,
Representative Foster votes yes.
Representative Jenga,
Representative Jenga votes yes.
Representative Green,
Representative Green votes yes.
Senator Haskell.
Senator Haskell votes yes.
I did not see you on screen, sir.
Sorry, Madam Administrator. Senator Haskell votes yes.
Thank you. Representative Cavros-DeGraw,
Cavros-DeGraw votes yes.
Representative Kennedy,
Representative Kennedy votes yes, with the hope that the concerns addressed today will be brought forward to the floor. Thank you.
Representative Clarides Detrier,
Representative Clarides Detrier votes yes.
Representative Lenahan, Representative McCarthy,
Representative McCarty votes yes.
Senator Moore, Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Tersiak,
Try again. Representative Tersiak votes yes. Thank you.
Representative Young, Representative Zupkis,
Representative Zupkis votes yes.
Senator Anwar, Senator Wong,
Senator Anwar votes yes.
Senator Wong, Senator Summers,
Senator Summers votes yes.
Representative Cook, Representative Elliott. Representative Lenahan. Senator Moore. Representative Scanlon. Representative Young.
Representative Young votes yes.
Representative Zupkis.
Again.
Thank you. Can you see me? I voted already. Thank you. Representative Zupkis votes yes.
Thank you. Thank you, Mr. Chair.
Thank you, Madam Administrator. Again, we will be keeping the votes open till 10:30 this morning. We will move to item 7 on the agenda, Senate Bill 374, an act concerning the Department of Developmental Services recommendations regarding the reimbursable salaries of directors of qualified providers. This is a JF. Do I have a motion?
So moved.
Thank you, Representative Gilchrist. Do I have a second? Seconded by Representative Pettit. This is a very straightforward bill. This allows the cost allowance cap for executive directors' salaries in DDS to be increased from 101,000 to 125,000. This is primarily to recognize that in order to get quality employees, and we have not raised this cap in many years, this will allow them to be competitive in hiring the best people. We have this issue across several parts of government. This is just lifting that cap somewhat to allow for effective recruitment. Are there any questions or comments? Representative Betts.
Yes, Mr. Chairman, I do not agree with this, and I would request we have a roll call rather than consent.
Thank you, Representative Betts. Are there other questions or comments? Seeing none, Madam Administrator, whenever you're ready, let's do a roll call.
Representative Steinberg.
Representative Steinberg votes yes.
Senator Anwar.
Senator Anwar votes yes.
Senator Kushner.
Senator Kushner votes yes.
Representative Gilchrist.
Representative Gilchrist votes yes.
Senator Wong. Senator Summers.
Senator Summers votes yes.
Representative Pettit.
Representative Pettit votes yes.
Thank you. Did someone say Beverly?
Senator Moore did.
Okay, I have to get back to you shortly.
Okay.
Representative Arnone.
Representative Arnone votes yes.
Representative Berger Givallo.
Representative Berger Givallo votes yes.
Representative Betts.
Representative Betts votes no.
Representative Betts, I did not see you, sir.
Can you see me now?
Yes, I do. Thank you.
I feel sorry for you. I vote no, Madam Clerk.
Thank you. Representative Carpino.
Representative Carpino votes yes.
Representative Cook. Representative Dauphiné. Representative D'Amico.
Representative D'Amico is always happy to see Beverly. Representative D'Amico votes yes.
Thank you. Representative Elliott. Representative Foster.
Representative Foster votes yes.
Thank you. Representative Django. Representative Green.
Representative Green votes no.
Senator Haskell.
Senator Haskell votes yes.
Representative Cavers DeGraw.
Stavros DeGraw votes yes.
Representative Kennedy,
Representative Kennedy votes yes.
Representative Claridas Detrier,
Representative Claridas Detrier votes yes.
I did not see you on screen, please.
Representative Claridas Detrier votes yes.
Thank you. Representative Lenahan, Representative McCarty,
Party votes yes.
Senator Moore,
Senator Moore votes yes.
thank you.
Senator Moore votes yes.
Thank you. Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Tersiak,
Representative Tersiak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
thank you. Senator Wong, Representative Cook, Representative Dauphiné, Representative Django,
Representative Jenga votes yes.
I did not see you on screen, Representative Django. Thank you.
Yes. Representative Jenga votes yes. Sorry for that.
Thanks. Representative Lenahan, Representative Scanlon. Thank you, Mr. Chair. We can't hear you, Jonathan.
Yep. Okay, we're moving to item 8 on the agenda, Senate Bill 376, an act concerning the Department of Developmental Services recommendations regarding ABLE accounts. For those unfamiliar, ABLE stands for Achieving a Better Life Experience. The ABLE program helps eligible individuals and their families save private funds to pay for certain expenses related to a disability or blindness. This is a JFS to the floor. Do I have a motion?
So moved.
Moved by Representative Gilchrist, seconded by?
Second.
We're going to recognize Representative McCarty. I did see your hand before I heard, sight before sound. Took time to travel here. This is a very straightforward bill that allows the funds invested, as we discussed previously, or contributed to or distributed from an ABLE account must be disregarded when determining an individual's eligibility for assistance under the State Administered General Assistance Program, or SAGA. SAGA generally provides cash assistance to single or married childless individuals who have very low incomes or don't qualify for any other cash assistance program and are considered transitional or unemployable. So this effectively just separates out the ABLE account funds from other calculations. Any comments or questions? Seeing none, can we add?
So moved.
Oh.
Representative Tersiak.
Oh, yes.
Mr. Chair,
Representative D'Amico.
yeah, I didn't want to cut in front of Representative Tersiak, but I guess I'm okay. All right. So, Mr. Chair, I seem to recall that the state treasurer suggested that this bill needed some revisions, and I presume that the substitute language reflects the revisions that the state treasurer had indicated. Am I right about that?
Spot on, Representative D'Amico. That's exactly the minor changes. These are based upon the treasurer's suggestions as per their testimony.
Great. Thank you very much.
Are you suggesting Representative Tersiak has more to say? I don't see his hand raised. So
Well, Representative Tersiak would like to see this on the consent calendar.
well, it's so kind of you to offer.
Thank you.
If there are no objections, I think we can all take up Representative Tersiak's excellent suggestion, and we will add that to the consent calendar. Moving along to item 9 on today's agenda, House Bill 5303, an act considering continuing medical education requirements concerning endometriosis and cultural competency, and the creation of a plan for an endometriosis data and biorepository program. As title goes, that is definitely on the longer side. This is a JFS. Do I have a motion?
So moved.
By Representative
Second.
Gilchrist, seconded by,
Seconded.
I'm sorry, who is that? By Representative Kavros DeGraw. This is a bill which enables, it does not require appropriate practitioners to add to their annual or frequent CME education, a study of the whole subject of endometriosis, which is frankly not well understood by many practitioners. That's pretty much it. Are there questions or comments? Seeing none, can we add this to the consent calendar? Seeing no objections, we will do so. Moving to item 10 on today's agenda. House Bill 5364, an act concerning the Tobacco Settlement Trust Fund. This is a JF to the floor. Do I have a motion? Moved by Representative Pettit. Seconded by Representative Berger Travalo, who I saw first. This bill is very straightforward. It is intended to assure that a portion of the tobacco settlement funds that Connecticut has been receiving for many years is dedicated to, frankly, its original proposition: education, smoking cessation, good communication. It earmarks the amount of $12 million. Reading the bill may make that a little obscure. There is $12 million worth in there, even though it's sort of broken up in different sections. I strongly encourage this bill be moved forward. It is, in my view, correcting a long-standing misuse of the funds to have them directed to the general fund. And we're hopeful that $12 million will go a long ways towards addressing smoking education and cessation activities. Are there any questions or comments? Seeing none, may we add this to the consent calendar? A lot of shaking heads, yes. So we will add it to the consent calendar. Our last item on the agenda for today is House Bill 5395, an act concerning an expedited licensure process for certain out-of-state healthcare providers and mental health care providers. This is a JF. Do I have a motion? Moved by Representative Gilchrist. Do I have a second? By Representative Foster. And just to be clear on this bill, it enters Connecticut into two interstate compacts: the Interstate Medical Licensure Compact and the Psychology Interjurisdictional Compact. For those unfamiliar, compacts are agreements by a variety of states to basically comply by each other's rules. A standard set of rules are established for licensure. This is intended to be a complement to other legislation that we are bringing forward this year, namely in House Bill 5001, the Children's Mental Health Bill. I believe maybe even a section of SB2, but it's our effort to address the workforce issues we are seeing in healthcare across the board. And the concept of compacts or reciprocity, so we ease the acceptance of qualified practitioners from other states to come to Connecticut to practice, we hope will go a ways towards alleviating many of the access issues we have in the state. As you might imagine, psychologists, psychiatrists in particular, are in great demand in the state. And by passing this legislation in combination with some other legislation before the legislature this year, we believe we'll be making significant inroads. Are there any questions or comments? Seeing none, may we add this to the consent calendar? Seeing no objections, we will add to the consent calendar. I believe, Madam Administrator, we are now ready to vote on the consent calendar. I have, if you would agree, items 2, 4, 5, 8, 9, 10, and 11. Is that correct?
Yes, Mr. Chair.
Then I propose we move forward with a roll call vote on the consent calendar.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes. Did you see me?
Representative Gilchrist. Yes, I did.
Representative Gilchrist votes yes.
Senator Wong, Senator Summers,
Senator Summers votes yes.
Representative Pettit,
Representative Pettit votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Betts,
Representative Betts votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook, Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott.
Representative Elliott votes yes.
I did not see you on screen, please.
Representative Elliott votes yes.
Thank you. Representative Foster,
Representative Foster votes yes.
Representative Django,
Representative Jenga votes yes.
Representative Green,
Rep. Green votes yes.
Senator Haskell,
Senator Haskell votes yes.
Representative Cavros DeGraw,
Cavros DeGraw votes yes.
Representative Kennedy,
Representative Kennedy votes yes.
Representative Clarice Dietrich,
Representative Clarice Dietrich votes yes.
Representative Lenahan,
Representative Linehan is safely parked and votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore is safely parked and votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan, Representative Scanlon.
Ryan votes yes.
Thank you, sir.
You're welcome.
Representative Tersiak,
Representative Tersiak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Senator Wong,
Senator Wong votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative Scanlon. Thank you, Mr. Chair. For those who have missed votes, can you stay behind to cast your votes, please?
Yes, we're holding votes open for another 22 minutes till 10:30. Just to remind members of the committee, we are back again on Friday at 12:30 to JF Moore Bills. And we then have a hearing on Monday at 9 a.m. via Zoom, and then a committee meeting Wednesday, the 23rd at 9:30 a.m. So we'll have a good day in session, and we'll see you on Friday. We are in recess.
Madam Administrator, this is Rep. Jenga. I wanted to see if I missed any votes. I may not have been heard on some vote.
Well, we got started, we moved fast.
Yeah, I talked to Billy and said the venture products, so pretty much everyone's in our caucus.
You're all set, Representative Django.
Thank you very much. I appreciate your help.
Madam Administrator, Mike D'Amico. How are you?
I'm well, thank you. How are you?
I'm doing well. I believe I need to vote on 331, which is item 3 on the agenda.
Yes, sir.
Okay, Representative D'Amico votes yes.
Thank you.
Thank you.
Hi, Madam Administrator. It's Rep Cook. I'm not sure. I think, well, I voted on a couple, but I'm not sure if you heard me. So I know there might be 2 that you missed, that we missed.
Senate Bill 331, you missed that one.
Rep Cook is a yes.
You miss Senate Bill 373.
Rep Cook is a yes.
And you miss Senate Bill 374.
Rep Cook is a yes.
Thank you.
Thank you. Have a great day, Bev.
Hi, Madam Administrator. It's Representative Linehan. I believe I owe you some votes, ma'am.
I thought we were raising hands to cast votes.
Oh, my apologies.
Representative Foster, I'll come back to you, Representative Linehan.
Thank you.
Representative Foster, Senate Bill 331, how do you vote?
Representative Foster votes yes.
I think that's the only one you missed, Representative Foster.
Oh, it was? Okay. I thought I missed 2.
Nope, I have you. Nope, I have you. I have you for, yeah.
Great, thank you.
Senator Wong,
Yes, ma'am. Thank you. What votes did I miss?
you missed Senate Bill 331, which is the
Wong
third
votes yes.
item on the agenda.
Wong votes yes.
You missed Senate Bill 373.
Yes.
And you missed Senate Bill 374.
I'm sorry?
Senate Bill 374.
Yes.
Thank you.
That's it. Thank you. Thank you,
Just one
Madam
moment,
Clerk.
let me just make sure. Yes, I think that's it, sir. Representative Elliott,
What did I miss, Madam Administrator?
you miss Senate Bill 373.
Rep Elliott votes yes.
You miss Senate Bill 374.
Rep Elliott votes yes.
And you miss Senate Bill 331.
Rep Elliott votes yes.
Thank you. And I
Thank
think
you.
I did get you on consent.
I think
Yes,
so as well.
Yep.
All right, thank you so much.
Thank you. Have a good day. Senator Representative Linehan, are you still there?
Yes. Hi, I am, Madam Administrator. Sorry, my raise hand function isn't working.
That's okay. Okay, you missed Senate Bill 331.
Representative Linehan votes yes.
Senate Bill 373.
Representative Linehan votes yes.
And Senate Bill 374.
Representative Linehan votes yes.
And you're all set on consent.
Excellent. Thank you very much, Madam Administrator. I hope you have a wonderful day.
Same to you. Thank you.
Thanks.
Senator Moore, are you still around?
I am.
Okay.
I'm here.
You missed Senate Bill 331.
Yes. Senate 331. Is that what you said?
And yes,
Senator Moore votes yes.
373.
Senator Moore votes yes.
You're all set.
Thank you.
You're welcome. Have a great day.
You too, dear.
Representative Dauphiné? I can't hear you. Can't hear you. I cannot hear you. For some reason, I'm not hearing you, Representative Dauphiné.
Good morning, Madam Administrator.
I'm
Did I
trying
miss
to
any
help.
votes there?
Phil, can you hold 1 minute, please?
Yes.
Representative Dauphiné, are you all set? I'm not hearing you, Representative Dauphiné. Phil, you missed Senate Bill 331. Representative Young?
Representative Young votes yes.
You're all set.
Great. Thank you, Beverly.
Thank you. Representative Dauphiné? Still can't hear you. I can't hear you.
Can you hear me now?
I can hear you now.
Oh, wow. Okay, I turned mute on and off. I'm sorry. My mute button was off. I mean, it was I don't know, whatever. So I'm a no. I'm sorry. Go ahead and give me the bills individually.
Senate Bill 331.
I'm a no.
Senate Bill 373.
A no.
Senate Bill 374.
A no.
And the consent calendar, we have item 2, which is Senate Bill 330, Senate Bill 368, Senate Bill 372, Senate Bill 376, number 8, House Bill 5303, House Bill 5364, and House Bill 5395. Those are all on consent.
Thank you, Madam.
How would you like to vote?
Yes.
Thank you.
Thank you. You have a nice day.
Same to you.
You're still on here on Zoom.
Hi, Sean.
What's up, Bev?
How are you?
I'm good. How are you?
I'm well, thank you. We have 3 roll call votes and everything else went on consent.
Okay.
Let me find my agenda here. Items on the agenda 2, 4, 5. Do you have the agenda? Or you want me to
Yep.
read? Okay. 8, 9, 10, and 11 on consent. How
Okay.
would you like to vote?
Yes.
Item
Voting on public health.
3 on the agenda, Senate Bill 331 is a roll call. How would you like to vote?
Yes.
Item 6 on the agenda, Senate Bill 373. How would you like to vote?
Yes.
And item 7, Senate Bill 374 is a roll call. How would you like to vote?
Yes.
Thank you.
Thanks, Bev.
You're all set. Thank you.
Bye.
Bye-bye.
Hey. Yeah.
Hey, Dallas?
Yep.
We got everyone, right?
Yes, we do. So I'll go ahead and upload all of those at 10:30.
Do you have the LCO for these bills? That's JFS?
I believe they were all sent.
Okay, let's
by
just
Eileen
go
yesterday.
right now over. Item 2 on the agenda is LCO 3510. Item 4 is LCO 345. Item 8 is LCO 3489. Item 9 is LCO 3525. And that's it.
Great. Okay.
And the next time we have a meeting, the chairs typically and the ranking members typically send the substitute language to their members or give it to them at caucus. They're not doing that, and it's an issue. So next time we will just send it, remind me to just send it to all the members later in the afternoon after we get it from LCO, because they really need to see it before they vote.
Yep. We're still live.
Okay. Huh?
We're still live.
Oh, we are? Oh, boy. Yeah, I didn't say anything wrong anyway. They still need to get it, because based on the discussion this morning, they weren't getting it. So we will make sure they do. Thanks. And since we have all the votes, we can just go, you can just go ahead and do the tally sheets.
Yep. It'll take me more than 10 minutes to have every single one ready anyway, so I'll be done by 10. Or
Yep,
after 10.
that's fine. Thank you. Dallas? Don't close out until 10:30.
Oh, no. I won't.
Okay. All right, I'm leaving.
Very good. See you later.